So when you have severe children that are very dysfunctional, where they haven't gone to school for a long period of time, they have lost their friends, they really have no social interactions. You're talking about pain-associated disability syndrome. And what this leads to really is it's sort of the development for children, particularly of a biopsychosocial model of chronic pain, where you have a predisposition, genetics, and we haven't talked about genetics that much here, gender, age, or true early childhood events, early childhood surgeries, then some insult maybe at that particular time. We see plenty of children who had chronic abdominal pain is very typical after a flu-like illness. They have gastroenteritis, like everybody else in the family, but that particular child will not recover. And that might be the inflammation at the time. And then you're dealing with psychosocial factors, and all of this is what you will see when you have the chronic pain. Now let's see, I know we're running out of time, so we did that. Pain assessment in children is, so the assessment and management in children is not quite as far advanced, or the treatment is less advanced even than the assessment in children for chronic pain. These are, it's often modeled on some of the adult pain assessments that have been used, which is okay when you're dealing with an adolescent. A 14-year-old will be able to fill out a McGill pain questionnaire, but you can't do that with a 4-year-old. And so we don't really have good tools for chronic pain assessment in very young children. And so we don't have necessary information on all of this, and a lot of it is observational. We're looking at coping, function, quality of life, catastrophizing, depression, and anxiety. And let's see, I'll move through. These are the assessment tools that are available for pediatrics at this point. There's a pediatric pain questionnaires. These are all standardized, they're validated, they're used in the pediatric pain clinics. We use the Bath Adolescent Pain Questionnaire. It's from the University of Bath in England. It's an incredible facility. They put their material on the website. They would like people to use it. It's freely open. They don't make any money from it. So it's a very sharing facility. It's a very nice one, the Adolescent Pain Questionnaire, because the questions are appropriate for adolescents. I mean, whereas the Varney-Thompson is really for younger children. As you can see, there are questionnaires for parents and children, coping, catastrophizing, and depression. We do most of that when a child comes to us. And then interdisciplinary therapy. So it's a complex syndrome in children. And so you really have to use all of your tools when you approach such a patient. It's really, you need your cognitive, behavioral, pharmacologic therapy, physical therapy, interventional therapy, not as commonly used in children because you probably, unless it's an adolescent, a young child, to say, well, this needle will really make it all better for you or might make a difference, you might not be able to, a 4-year-old is not going to hold still. So you have to sedate the child. That's an extra step. And so it's not as commonly used.
Excuse me?
Yes.
Yes. I'm thinking about recreational therapy in pediatric acute care settings, whether it's free play but especially medical play. Is that included there in
it's
your...
sort of in the cognitive behavioral therapy, that's where that would be. Play therapy is a little bit easier. Play therapy we would use say in a young child. That's where distraction, redirecting, and so forth. All right, we don't have that much time. I wanted to, there are 2 2 slides. A lot of the therapy overall is modeled on adult care, so we use the same drugs. There's a whole lot less information on it. As we said, new approaches to therapy, because there's an app for that. Tanya Palermo from Seattle, Washington, she's looking at internet intervention for adolescents with chronic pain, so that's an ongoing study at this point. It's really just started, so that will be very interesting. And one of the reasons why are we interested in this is really, I'll go to the next slide, this problem. So this is access to care for children with chronic pain. These are the pediatric pain clinics in the United States for chronic pain, and you can see there are many states, there are no pediatric pain facilities. And this is the recent update. If I had shown you the one from a year or 2 ago, there would have been even fewer. Not all of these facilities can do very comprehensive care. You can see this is a bundle here. We are in there. There's one in DC. Here in DC, DC Children's has one. CHOP has a pain clinic. There's nothing, this is a new one in Atlanta. There was nothing south. The whole south was without any pediatric pain facility. There's one in Dallas, Texas. So this is a problem. It's also a problem when you have a patient who comes to you. I often get patients from West Virginia. Where do you send them? You can't tell them to come back next week for cognitive behavioral therapy. So this is an issue for us that we have to work on. And some of it will be we have to develop the providers. Really, we have to grow providers. I think that's it, right? Pediatric pain research. The FDA, it's a little harder. Children are considered a vulnerable population, so it's a little harder to sign them up. On adults, you can do a pain study and you can say, okay, it will burn a little bit. With, say, a 6-year-old, you can't really sign up your child and say, okay, it will be just a little bit of pain. So you can do this with an adolescent. They can give assent. But a young child, you cannot really consent them. So that is one of the reasons why pharmacological therapy is far behind that for children, is far behind that for adults, because we really don't have the studies. We also don't see as many children who might use chronic opioids. There isn't a week where I don't get contacted by a company trying to sign up patients. Every week we get them. So where they want to sign up some of our patients. And so that's an issue. So the FDA had the scientific workshop, and we're actually in the process now to, it's almost ready to be started. It comes out of Seattle, Washington, and it will be a pain trial consortium with multiple pediatric medical centers to address this problem and to deal with industry.